is Joe Dimatteo Jr. I am a pharmacist and clinical nutritionist. I'm here today to talk about a very hot-button issue. Some may call it very controversial issue, and that is CBD oil. The chemical name is cannabidiol. Okay, we're going to go over some real broad points. I'm really going to try to cover the basics here today. Primarily, we're going to start with what is CBD oil, what makes it different from marijuana or from THC. Okay. We're also going to go into how does CBD oil work in the body and what's it good for. All right, and finally, we're going to go over if it's something that you do decide you want to do, how do you know you're taking a quality product, okay, that's going to be safe and effective. All right. What I'm not here to do today is claim that it's a panacea and that it's a miracle, drug or supplement, and that it's going to fix everything you've got going on. Okay, that's not what I'm here to say. I'm also not here to say that everybody should be taking it, all right? It's not going to be a situation where, our primary recommendations are vitamin C, vitamin D, fish oil, a quality multi, and CBD. That's not really what I'm here to say either. If it's something you're interested in trying, go for it. I think when I go over more of the information here, it may be something that you're comfortable with as well. But for right now, we're just going to kind of go over the basics of what CBD oil is, okay? So what is CBD or cannabidiol? It's a cannabinoid, okay? Basically, that just means that it works on the endocannabinoid system in the body, all right? And we'll get there in more detail. But I think that a quality introductory piece on CBD must include some discussion of marijuana and THC, okay? I think differentiating it from marijuana, kind of clearing out some of the noise is very important. All right, so I think a place to start would be with the word cannabis, okay? Cannabis is the genus of the plant, okay? And it's from there are species and subspecies. So you have marijuana is one of those species, subspecies, and so is hemp, okay? Marijuana, THC, hemp, CBD, okay? It's kind of like, I think a good analogy would be a canine. So you've got canine family or feline family, but within the canine family you've got, house dogs, and you've got foxes, and you've got wolves, and yeah, they share that common link, but they're very different practically, all right? Feline, same deal, house cats, lions, I think you get it. So I think that's a critical piece is where does this start? It starts with the genus of cannabis, and then the subspecies for these things are different, marijuana and hemp, okay? Marijuana, practically and legally, it's about the THC, okay? It's 15 to 40% THC content, okay? That's the main gist of the marijuana plant, okay? It also can be bred to have some CBD, nothing wrong with that, it doesn't change its legality. It has two main uses, all right? First one, recreational, gets you high, I think we all know that one. Secondarily, medicinal. It's a good appetite stimulant, good for anti-nausea, anti-seizure, also lowers intraocular pressure in the eye for people with glaucoma. It also has a lot of benefits to neurological and GI symptoms, okay? So I think that's basically where we are with THC, all right? But there are issues with THC. It gets you high. That's desired by some, but certainly not desired by everybody. It comes with a lot of downsides, okay? Over time, it'll decrease your dopamine production. That's the reward neurotransmitter. So you're smoking marijuana or however you're doing that. It's getting you high. It's firing off that dopamine, and you take it away, and you're depressed. You lose motivation. You hear that old pothead kind of syndrome. You're down. You lack motivation. It affects your mood when you take that away, okay? It's because it's a psychoactive drug. It's working on the brain. It's making you high, okay? So dependence obviously comes along with that. Long term as well, you have increased risk of psychosis, schizophrenia, and paranoia, okay? So that's kind of in a broad stroke, the good and bad of THC. So now done with the marijuana plant, the hemp plant, that's what we're really here to talk about today. That's the CBD, okay? The plant itself legally can contain 0.3% of THC or lower, okay? And that's the original plant. CBD, cannabidiol, has no psychoactive properties. It does not get you high, all right? Hemp is also used not just as a source for CBD oil, but it's also used in industry, paper, clothing, building materials, things like that, okay? And the reason why it's become very hot for CBD is because there was a recent bill passed, 2018 Farm Bill, basically allows CBD to be extracted from it. So it went from a very gray kind of thing that people were doing. Now it's in writing that it's clearly not banned, okay? So again, I think to wrap up the difference, they're different plants. Yes, they have that same genus. Yes, they have similarities. Marijuana, THC, and hemp, CBD, are different plants, okay? So whatever one you're doing, the CBD or THC, what is it doing in the body, okay? They're cannabinoids. They're working on the endocannabinoid system, all right? It's not the most understood system in the body, but mainly what it's doing is it's talking to other systems in the body, okay? It's trying to maintain homeostasis or equilibrium, all right? So again, it's not directly doing a whole lot. It's modulating neurotransmitters. It's talking to other systems in the body, whether it's pain, inflammation, various different brain chemicals, even some links into fertility. So it's not the most understood, and it's also a little bit on the scope of what we're talking about today. But basically, that's what the endocannabinoid system does. That's what both CBD and THC work on, okay? So I think here's the thing. Your body's not just sitting here with the endocannabinoid system and it's just waiting for you to take THC or CBD, okay? You have a God-given endocannabinoid. The endo just means it's in your body. Anandamide, okay? Your body makes that and it's using the endocannabinoid system to talk to those other systems like we talked about, okay? So again, the system's not just waiting for this CBD for you, okay? But when things are a little off, like a lot of different systems in the body, and you can take something exogenously, an exocannabinoid, we'll call it, like CBD, it can help to get things in balance for you, okay? So in the endocannabinoid system, there are two different types of receptors. Pretty simple. CB1, brain, okay? It's the big one for THC. CB2, the rest of the body, and also the immune system, okay? So CB1 is where THC really hits. It's an agonist at CB1. It hits that receptor, it excites it, it turns it on, which then sends dopamine flying. Again, it's working on other systems, okay? So that's the big thing with THC, is that CB1 receptor. CBD, okay, interacts with that same CB1 receptor in the brain. But what it doesn't do is it's not an agonist, it's an antagonist. So what it actually does is it hits that receptor and it binds, but it kind of calms it. It soothes it. It's there. It's an antagonist. It still binds there, okay? Versus an agonist, THC, which excites it, activates it, gets you high. Okay, so what comes along with that CBD effect and that antagonism at the CB1 receptor is you get decreased anxiety, decreased depression, okay? It also helps with cravings. That kind of that link back then into the dopamine. So it actually has shown to decrease cravings in drug addicts and in alcoholics, okay? So CB2 receptors are where you get a lot of the other benefits, the main ones we're here to talk about, and the rest of the body. To be honest with you, THC and CBD are pretty similar in that regard, okay? So I would say, in my opinion, the main difference in terms of the way, generally, the THC and CBD work in the body have to do with the brain, okay? And CBD does not have those negative effects on the brain that THC does, okay? And knowing that CB2 has similar activity between the two, and marijuana has been studied for a long time, I personally can kind of deduce that down line, we're not looking at a situation where this CBD is so new and that people are going to have all these issues if they start using it, okay? I don't have a 15, 20-year study to show you that. You take CBD for that long. I don't have that, but just deducing all we know about THC and its periphery, the CB2, the rest of the body, versus what it does to CB1. CB1, again, is where all that THC agonism causes issues, all right? So just kind of to wrap up the endocannabinoid system itself, again, it's about modulation of the other systems in the body, okay? It can affect neurotransmitters, pain, also a lot of GI and neurological issues, all right? So now on the CBD oil itself, like we talked about, decreasing anxiety, modulation of those neurotransmitters, decreasing drug and alcohol cravings, okay, via that blockade, that antagonism at the CB1 receptor. Also modulates the opiate system. So it helps to kind of calm and interacts with the opiate system. That's where all types of pain relief are found, okay? Also interacts with the inflammatory pathways, of which in the body there are many. It interacts with all of those, okay? CBD oil is also shown to help improve symptoms in various neurological diseases such as MS and Parkinson's, all right? There's even some things showing it helps with secretions and acne, okay? So that's, again, in a broad stroke, the benefits of CBD, what it's working on, all right, and also how it's differentiated from THC, all right? Now, when using CBD, the oil, you do want to use it sublingually. That's going to increase effectiveness. It's also going to, via increasing the absorption of it, all right? So under the tongue, it's an oil. It's not the easiest thing to do. What I recommend people do, tilt your head back a little bit, do it drop-wise. Don't just squirt the whole 1 ml in there with the dropper. It's going to be under the tongue. Do it drop-wise, a few drops at a time. Try not to swallow for 30 seconds to 2 minutes. I think that'll help you to maximize absorption, okay? The other thing you can do with CBD is you can use it topically, all right? Now, that's really only going to work for pain and for superficial pain, okay? It's going to work for arthritis, neuropathies, things like that. So that's very convenient. It also ends up being a little cheaper because you can use a lower dose when you're using it right to the site, all right? Also, when you're doing the topical, you can combine it with other things. For example, our product, Hemp and Hops, has some natural anti-inflammatories in it, like arnica. It also has some soothing ingredients like eucalyptus oil, menthol, even has some glucosamine and chondroitin. Okay, so, and you can do both. You can do the sublingual and the topical, if you're, again, topical really being only for pain. Okay. Now, another thing to watch out for at CBD is there can be some drug interactions. So if you're on some medications, including statins, antifungals, antivirals, certain antibiotics, even transplant drugs, if you're on medications, you do want to be careful whether you're getting a quality product or not. Just watch that, okay? That's obviously going to be all individualized. So now, if you decide that CBD oil is something you'd like to do, I'll tell you a little bit about how to ensure you're getting a quality product, okay? There's 3 phases to it. You've got the plant itself. You've got to make sure that the source plant is of quality. You've got to make sure that then that source plant is extracted properly to get the CBD out of there, okay? And then you've got to make sure that the final product that you're getting and you're actually picking up off the shelf is what it's supposed to be. It has in it what it's supposed to and doesn't have in it what it's not supposed to, all right? So we'll start with the plant itself. You want to make sure that the hemp plant source that the CBD is coming from is grown organically, so it's pesticide-free, GMO-free, heavy metal-free, okay? Really no different than what you'd look for in a quality fruit or vegetable, all right? Then you move on to extraction, and you want to make sure it's not extracted using chemicals or solvents, all right? CO2 extraction is the best. It's what we use in ours. Basically what it does, and it does require expensive equipment, but it infuses carbon dioxide into the plant, okay, under conditions of high pressure and low temperature, all right? And under those conditions, the CBD will seep out of the plant, okay? Then when you return the pressure and temperature to normal, the CO2, the carbon dioxide just evaporates, but the CBD's already been separated out, okay? So it's very safe. It's simply using pressure, temperature, and mainly carbon dioxide, all right? And then finally, if it's grown properly and it's extracted properly, what's in the bottle you're getting, okay? It needs to be third-party assayed. A company can test their own product, that's fine, but obviously they're a little biased, okay? So you want a third-party assay, it just means somebody else is testing it, okay? And they're going to test it, A, to make sure that the CBD oil, the CBD content that is labeled on that bottle is actually in there, okay? You want to make sure THC isn't in there, obviously. You don't want to get high from it, and you also have to watch out. You don't want to end up failing drug tests for some low dose of THC in a poor quality CBD oil product, okay? You also want to make sure it's free of heavy metals, pesticides, bacteria, fungus, contaminants, etc. All right. So our product contains 0.01% or less of THC. Okay? It doesn't mean that there's absolutely not a trace in there, but it is so low that it's well below the legal standard of 0.3%. It is 0.01. Okay? So you will find that quality ones are 0.01 to 0.03. It's not going to cause a fail on a drug test. It's certainly not going to get you high. It is minuscule, okay? But technically, because of the source where it's coming from, you can't quite guarantee that it's 0.00, okay? It's less than 0.01, all right? So again, if you're faced or you end up taking a poor quality product, you are at risk for using chemicals and solvents in the extraction process, such as butane, propane, rubbing alcohol, and acetone, okay? There was a 2017 study done that showed 1 in 5 products that they tested had significant amounts of THC. Not 0.01, not 0.03, not 0.3, significant amounts of THC in the bottle, okay? Furthermore, that 43% of them, according to this study, did not have anywhere near the CBD in the bottle that the label claimed. Thank you for taking the time to view this video. If you like what you heard, please give it a thumbs up. And don't forget, stay up to date by subscribing and ringing the bell below. Thanks again.